Hi guys, it's Nareda Boyle and I'm here with part 2 of our breastfeeding series, and today I wanted to talk a little bit more about nursing positions as well as what to expect the first few days if you plan on breastfeeding immediately after giving birth. So the first thing I wanted to talk about is breastfeeding positions, and I wanted to show you all this pillow. It's called a nursing pillow. I believe this is the Boppy, but there's also different ones called My Breast Friend, and these can be found at Walmart, at Target, online. And if it's in the budget, or if somebody gifted one of these to you, please utilize it because it does help with positioning. I'm going to go ahead and demonstrate how this one would be used. You just wrap it around your tummy area and just position it there. When you are breastfeeding, you want to try to be somewhere comfortable. If you have a footrest, go ahead and utilize that. If you have a glider or a rocker recliner, you can also utilize that. Just try to get yourself in the most comfortable position because baby feels emotion, and right after you had a baby, it can be highly emotional, it can be stressful, it can be anxious, you can feel overwhelmed, and that may affect your milk supply. So you want to get yourself in the most comfortable position. And also, if you have someone who can help you, do not be afraid to utilize them there. They're probably more than happy to help you. It's just sometimes as moms, we're a little too proud or we don't want to bother people, but most of the time they are willing and wanting to help. You just have to ask. The first position I wanted to talk about is referred to as the cross cradle position. And the reason it's called the cross cradle is because you're crossing your opposite arm that you're going to feed with, and you're cradling baby's head like this. And this is where I wanted to mention that these pillows really great because it really helps with the ergonomics and the positioning. So you would put baby, you would cradle underneath, and you would offer the opposite breast. The most common position is called as the cradle position, where you would cradle baby's head, position body inwards, and feed this way. The third is referred to as the football hold. So think of yourself kind of like a linebacker, and you would position baby under your underarm, and the arm or the side that you'll be feeding on, you want to support head and offer breast that way. And the last would be, I won't show it here, but I will demonstrate, I will talk about it a little bit, is referred to as a lay down position. So this is really great for anyone who's had a C-section or is having some pain issues with recovery, and you'd be laying down offering breast, and you'd be offering the side that is closest to the surface. When a newborn is born, you want to offer a feeding session every 1 to 3 hours, or 8 to 12 times a day. One of the things I wanted to talk about here is what to expect the first few days. So when a baby is first born, they have really tiny stomachs. So their stomach is about that big, and their first diaper will be this color. I know a lot of people may be afraid of this or may be concerned. So diaper may look a little like this, completely normal. That first milk has colostrum, or is referred to as colostrum, which is rich in antibodies and all this amazing. It's often referred to as liquid gold because it's full of all these properties that you can't reproduce anywhere else. And that's the first milk that will come out. Baby's tummy, again, is very tiny, so they won't eat very much, but they will need to eat often. By day 3, the color of their diapers may be more of an avocado kind of looking, kind of like this, and their tummies have grown to about this size. So don't be concerned if diaper color, it looks a little bit like this. By day 5, their tummies are even bigger, so they'll be about that size, and the diapers will take on the color of kind of like a mustard, seedy kind of look, so it'll look a little bit more like this. The type of milk by that day will have transitioned from colostrum to transitional and then mature milk. Even within the milk itself, there is something referred to as hind milk and fore milk. Fore milk is the first milk that comes out when you are nursing, and it has more of a watery consistency. And as you continue the session, it will have more of a thicker, more whitish color. So that is completely normal. And even the components of what is in that milk are a little bit different. That hind milk has a higher fat consistency. Again, you want to try to get yourself in a comfortable environment because it's an opportunity to bond with baby. It's an opportunity to share your bodies. And if when baby is first born, they're often sleepy and they may fall asleep while nursing. So one of the things that they recommend, if that is happening, is you offer some skin to skin. So undress baby completely, just leave the diaper, and offer some skin to skin, and that stimulates that instinct, because babies have instincts of wanting to nurse. When you nurse, it is a supply and demand. So the more you offer the breast to baby, the more your body is going to produce. And again, it's 8 to 12 times a day. Breastfeeding may not come easy to everyone. Breastfeeding is a natural thing, but it's not always easy for everyone. And a lot of times women don't feel comfortable sharing that. But there is a bunch of resources available to you that can help you. The most important thing is getting proper latch. And a lot of times new moms, not as much experienced moms, just are so interested in feeding baby that they don't even care about the proper latch, and they're later having pain, having cracking, and may abandon breastfeeding altogether. So take advantages of those resources. That at the hospital there is lactation nurses and specialists that may help you get the proper latch and may help you with positioning and give you just some tips. Also outside of the hospital, there is some lactation specialists. WIC offers a number of resources if you do receive WIC services. So please take advantage of those services. That's what they're there for. If you have any more questions about breastfeeding, next week I do want to touch upon pumping and storing, especially if you plan on returning back to work. But if you're interested in more about our Family Spirit program, please give us a call here at the project at 320-0490. The Family Spirit program is a program for expecting Native parents as well as parents or caregivers of Native children under the age of 3, and we offer a number of services aside from doing sessions on breastfeeding and what to expect during delivery. We touch on a number of different topics from parenting to child development. So if you want to join the program, please do not hesitate and give us a call here at the project. Again, that number is 320-0490.